Doctors and nurses of Reddit, what is the most obvious sign that a patient is lying to you? I'm not in clinical practice anymore, but when I worked as a midwife, it wasn't so much as this person lying, as why do they feel they need to. People usually aren't trying to deceive for fun. They're scared, ashamed, overwhelmed, or worried about being judged. Sometimes they're protecting someone else. Sometimes they don't have the language for what's happening, so the story comes out crooked. The lie was never the interesting part. The real question was always what made this person feel unsafe enough that lying felt like the safer option. Fear and shame are far more common than manipulation. And once you try to understand the reason behind the lie, the whole conversation shifts. I'm a paramedic. But one thing I try to live by is to never assume someone is lying, even if I really, really think they are. If someone is slurring their words and can't walk but swears they didn't drink, I'm going to try to find out more but ultimately run it as a possible stroke versus assume they are lying and treat them as just another drunk. My personal philosophy is that I would rather be wrong because I did believe you and you were lying rather than wrong because I didn't believe you and you were telling the truth. If you lie to me, that's on you, but if I don't believe you, that's on me. So unless I have physical proof that the patient is 100 lying, I'm going to believe them. If it is bad habits or addiction, you get evasive answers, never trust a patient. Conversations usually go like this. Do you smoke? No. Did you smoke in the past? Yes. So how long did you smoke? Don't know, maybe a few years. When did you start? 16. When did you stop smoking? Not that long ago. Patient is in his 60s now. When was your last cigarette? This morning. But I cut back on cigarette use. It was a lot worse. It is only 1 pack a day now. Reeking of smoke, cig, or weed and saying you don't smoke, then doubling down when expanded to anyone in the house smoke. Luckily, we get kids ratting out their guardians fairly regularly. What sucks is actually being allergic to a painkiller. I had a bad reaction to tramadol. Face swelled up like a balloon. So I mentioned that, and next time I was in the ER, they wouldn't give me anything more than Tylenol. Had that removed from my chart. Ill forever lie now, nope, no allergies here. I'd rather go into pain-free anaphylaxis than be treated like a drug seeker. My 10-year-old went in for a well visit, and the doc who had seen him since he was newborn casually asked him about the bruises on his shins. I'm trying to learn a kickflip, he said. It was only later that I realized the doc was actually screening for child abuse. Thank you, medical professionals. I only drank 2 beers. Breath could ignite a barbecue. Eyes look like Windows 98 trying to reboot. Yes, I wear lotion every day, just not today. As their skin flakes off like snow all over the exam table, I work in dermatology, where a majority of my patients are older and complain of dry, itchy skin, especially during the wintertime. I was the patient in this situation. I lied because no one would take me seriously. I was having these awful episodes of chest pains periodically, had no energy, stomach pain, and my hair was falling. I had always been healthy, and all of a sudden it was like my body's check engine light came on and everything went wrong at the same time. I kept getting told it was just hormones because I was 27 and my body was changing. No testing was done. Just hormones, it happens. One day I had an awful chest pain episode at work and was sent to the hospital. Honestly, you couldn't have told me I wasn't having a heart attack. During triage, I was asked if I was having any other symptoms at that moment, and I said yes to everything. They did blood work, EKG, echo, etc. Turns out I had pericarditis and having panic attacks. I was going through some life events and my stress level was astronomical, but since I had never experienced panic attacks before, I didn't know they could mimic heart attack symptoms. I had an amazing male nurse who came into my room before discharge and saw me crying out of frustration and relief because I finally had an answer that wasn't hormones. He pulled up a chair, took my hand and said everything will work out. He told me stress kills, explained what signs to look for before a panic attack set in and to keep track and see if I had any triggers. He even showed me some breathing exercises that I still use to this day. I followed up with a cardiologist who took care of the pericarditis, but the nurse's compassion and understanding has stayed with me for years. Thank you, Brad, wherever you're at. When they're eating, chatting, laughing, talking on the phone and playing games but say their pain is 10-10 and only the really strong narcotics will work. Being evasive, not answering the questions purposely, being belligerent and defensive when you ask something routine like medical history. Question: symptoms don't add up with labs imaging, prior medical history from other visits in the same hospital system, pharmacies, etc. Tell me you're lying. Accusing the staff of lying or falsifying records, and it's a general rule of thumb that patients underestimate their alcohol consumption and underreport medication non-compliance. So we also assume everyone lies on those questions. It's like your dentist asking if you floss daily. They already know the answer before they ask. When someone was shot or stabbed by these two guys while minding their own business, particularly if they are on the phone sorting out retaliation when you walk into the cubicle. If the police could arrest those two guys, there'd be no crime left. A psych patient on my unit faked a tonic-clonic seizure and even urinated on herself in a room full of other patients. I immediately knew it was fake because she was yelling for help while writhing on the floor. No actual seizure activity, no post-ictal phase. She sure had everyone else convinced though. And I was the bad guy to the other patients because I wasn't taking it seriously. Allergy list includes things it's literally impossible to be allergic to. While I realize that sometimes meds are listed because of a binder or coating, sometimes we see things like normal saline on the list and just know this person is going to be a handful. The studies we do have in medicine highlight that people in distress may act differently than expected, and that we as people are not great at determining lying versus truth. Might as well flip a coin. Maintain your curiosity and humanity in assessment and treatment. One such article I have my resident learners read. I'm a paramedic and I can tell when people lie to me in any situation in my life. I take people at their word, I treat patients based on their clinical findings, and I document exactly what they say using quotation marks. Even if I give pain meds to someone that's got a minor complaint because they're drug seeking to stop withdrawals, it's safer in that moment for them to have the drug than to withdraw with me as their only resource for the next 50 miles. They can go through medicated withdrawals safely at the hospital later. We can deal with the underlying problem when it's safe to do so. If someone lies to me, it speaks on their character, not mine. As a nurse, I'm not the police. I can't go to your job and tell them so-and-so smokes crack, or go to your wife and say so-and-so likes to take big dildos up their butt. Tell the truth. Generally speaking, people rehearse the story one way. If you ask them to tell you what happened starting at the end and going backwards, then the story beats change up. Also, and this is not an indication that someone is lying, but something to look for is how much they are looking at you. Contrary to popular belief, a liar will look at you in the eyes more often because they need to see that you believe the lie. Clinical presentations differing from what they're telling me. Even if they tell me one thing, it's always best to go with what they're telling me, then circle back to what they aren't unless it's an obvious lie. I work in PEDS, so it's very often I get differing stories for possible abuse cases, so I've gotten some practice in piecing together what they aren't telling me. I work in an ER that has a large number of group homes nearby. The people who live there usually have developmental disabilities or behavioral health issues, and often both. There is also a pretty decent-sized homeless population. Between the two populations, I definitely see at least one fake seizure per day. A small percentage are really good at faking seizures. Most are not. They will flail around attempting to portray a tonic-clonic or grand mal seizure, then immediately start talking and answering questions after. That's not normal for that type of seizure, or sometimes they will talk during. I had one lady hold an arm still so I could get an IV while actively shaking the rest of her body. One patient I asked, "Oh, are you having a seizure now?" And she answered yes. Another patient I had recently was turning his whole body over, up on his hands and knees, then flop back down on his back. When I walked into the room because I was afraid he was going to flip himself off the bed, he looked at me and spoke through clenched teeth. "I need some medicine." Of course, I know seizures can have lots of different presentations. They're real until proven otherwise. However, it's pretty easy to spot when someone is faking that they can't control their body, and then they do something that tells us otherwise. The pause before answering a yes or no question. Such as, "Do you use drugs?" I know immediately. The pause is them calculating if they should tell me the truth. For them to rapidly answer if they use tobacco. If they drink alcohol, and then to pause before answering. The drug question is a dead giveaway. PT says he didn't eat anything since 6 p.m. the day before surgery. proceeds to aspirate a full meal once under anesthesia, almost 24 HRs later. He also had no risk factors for delayed gastric emptying. NAD, EMT, my pain is a 10 out 10. Meanwhile, HR is 82, BP 2080, RR 14, skin is warm and dry, and they're on their phone scrolling. Sure, dude. Lab results, odor, sudden changes in vitals behavior, physical examination, etc. Often we 100 know a patient is lying about something, but rare we address it directly unless it's a safety care issue. It's none of our business if you like to party or have things in your butt, but it is amusing to hear someone decry the scourge of drug abuse on the streets, with a tox screen showing the array of substances they used before coming in. Funniest one for me was a patient denying smoking in the room, despite the powerful odor of a lit cigarette and the cloud of smoke in the air. It's like babysitting children sometimes. I'm an emergency med doctor. I frequently get patients that are supposedly in 10-10 pain, worst they ever felt, and need morphine now. Yet when I walk in, I often find these patients looking totally unbothered and scrolling TikTok. And of course, 95 haven't tried any OTC pain meds before going to the ED. Sigh. So I work in psychiatry, and honestly, am quite bad at discerning when someone is lying. However, to me, it's the pattern surrounding something or the reaction to my question that speaks volume. People usually ask for things for a reason, and in psychiatry we sometimes have to keep stuff at the nurse station due to many possible reasons. So when someone asks me for something very specific and unusual, and well, I'm a curious person, and I ask why and I get a very vague or dismissive answer, or the person immediately gets irritated or angry, I can immediately tell something is going on. Normal people with normal reasons will go, oh, I need XYZ to do this and that. And so, honestly, you would be lying to me in my face and telling me the most logical fake reason calmly, and I'd probably be, sounds reasonable, here you go. But it's the dismissive nature and all that just makes it so obvious. Here's an example. Once I had this old lady patient and she was like, my nail guy is going to pick me up at 6 p.m. I know it's a bit unusual, but this will do great for my mood. And I was like, yeah, sounds like a good idea. After he picked her up and she came back later without her nails done, she told me she changed her mind, but still hung out with the man and had a good time. To me, it did sound unusual, but somewhat reasonable. And then my colleagues went, he was a male prostitute, right? Never could have guessed. But oh well, no wonder it helped her mood. I've been accused of lying simply because I take opiates for my chronic pain condition. When I was trying to get diagnosed while my primary managed my pain, I went to a specialist. Because there was this weird suspicion by the specialist I was going to, that I wasn't actually in pain, I told the nurse I'm already medicated. I'm not here for a prescription, I'm here for a diagnosis. The doctor did the exam, then proceeded to dress me down. He told me he was tired of you people that claim you're in pain, conveniently loosing you prescriptions, which has never happened. Calling at 3 a.m. because you're all out of your pills also never happened. If you're really in the amount of pain you say you're in, you'd go to this clinic. He gave me a pamphlet for a clinic where they get people to ignore their pain. I walked shuffled really out of there sobbing. My primary was so awesome. They said, I will never let that happen to you again. From now on, you're only going to specialist I'm familiar with or I'm calling before your appointment. They gave me a referral for a specialist they interned under. That's when I finally got my diagnosis. PICU Ped Ed Nurse. Anytime someone says this about an infant with fractures, head injuries, or numerous contusions, they just rolled right off the couch. NAD. But I can 100 tell you that doctors and nurses are 100 full of and can't tell any obvious signs whatsoever. I've assisted my wife in psychiatry over 18 hospitalizations and over 450 days hospitalized. The number of times they told my wife she was faking it. It only stopped after an attempt put her in a coma. Oh, maybe she's not faking it. Doctors and nurses are all megalomaniacal people who are full of, now this ain't it BC. There's way too many practitioners out here not believing patients who are telling the truth, especially women in POC. Believe your patients. And if you're a shitty diagnostician or rely solely on labs to treat, just say that so I can find a better doctor. I know medical professionals often hear lies, but even when you are telling the truth, they sometimes don't believe you and feel judged. I had 2 medical emergencies at different times in my life, bleeding ulcer and pancreatitis caused by gallstones. Both times, the doctors didn't believe me when I said it wasn't caused by alcohol use. When I was in the ER with pancreatitis and a diluted haze, I tried to explain to the nurse that the doctors didn't believe me when I say I am not a drinker. She reassured me and said the blood tests will show that I was telling the truth. I had a kidney stone and the pain was horrible. I was shaking and throwing up from the pain that I tried to tolerate for hours, so I went to the ER when the pain wouldn't go away. Doctor asked me how I knew it was a kidney stone, and I said because it had them before. I think he thought I was there for painkillers. I mean, I was, but for the kidney stone pain. I could tell he thought I was full of. Sure enough, I get a scan and both kidneys are full of stones. I felt vindicated. Yeah, I can recall at least 3 occasions when nurses thought I was drug-taking, drug-seeking, and they were wrong every time. I'm actually a very boring and straight-laced person. Your intuition might be a useful guide sometimes, but other times you've got it dead wrong. I used to work on a detox unit, and when admitting patients, I would routinely ask how much they drink. Sometimes people would claim that they drink like 3-4 beers a week or 1 to 2 glasses of wine daily. Meanwhile, they have tremors and they're sweating like no tomorrow. Not a doctor. A few years ago, I went to a clinic because I had strep throat. I waited for just under 2 hours in the waiting room before being called in, and I am a pretty cooperative and polite person. For some reason, the doctor and Pa, whoever I saw, was somehow offended when I responded with, "I have strep throat," when being asked what brought me in today. He was put off by my self-diagnosis, I guess, but I had it a ton as a child and had my tonsils removed young because of how frequently I was getting it. It's a very specific throat pain to me, and I thought I was being helpful by not presenting a number of symptoms at once. He ran a rapid test and came back really quickly to tell me that it was negative and how to care for a sore throat and cold. I very politely was like, "Oh wow, I'm so surprised. It feels very much like strep throat, I can't believe it. Thanks for your time, etc., etc." And he offered, "Well, I mean, I can run the other test if you want to, but it's always positive on the rapid when people have strep throat." And I said, "Well, since I'm here anyway, if you don't mind, could we run that?" He did. I got a call the next day because I had strep throat. I always wondered if he lied or if it really was negative alongside him being for no real reason. We know diseases, we know disease patterns and progressions, and so suddenly noticing your fulminating breast tumor in the shower this morning is a lie. The common one is something shoved up the anus and lost. No, you weren't dusting in the on top of table and fell into the fruit bowl veg basket. People don't do that. Male patients when I ask their height. Female patients when I ask their weight. I am positive about 75 lie to me. When I'm at work, you'd think being 63 is an average height. Always assume patients lie about and drugs. We had plenty of falls with fractures coming in recently to the ED. I only had 1 or 2 drinks, and their alcohol levels are 2 to 3x legal limit. Most people probably do it because they're embarrassed or ashamed. We want to know how much patients drink because alcohol withdrawal exists and it's deadly. If their honesty is super important to their case, the reason their honesty is important is explained to the patient. Be kind. Appear understanding and helpful, and usually patients are forthcoming. As far as the signs that a patient is lying to you go, they don't really matter. I worked in the ER for a few years, and the most obvious lie is when they come in with something traumatic, and they start the story with, "So, I was just walking." Nobody who is just walking ends up with a dislocated shoulder, or a perfect circle burn on their forearm, or a massive orbital fracture. They always downplay the actual wild thing they were doing just before the incident. You learn to cut them off and say, "Okay, you were walking. What were you doing just before you started walking?" And then the actual, much better story comes out. "Well, I was trying to jump over the neighbor's fence while holding a flaming tequila shot." I'm glad this thread went from, "Why are people such liars?" to, "As a health professional, you should assume people are telling the truth and backing it up with real stories." As a group, women and Black people are not listened to in healthcare settings, even when they present with unambiguous symptoms and test results. Far too often, a nurse comes to the indefensible conclusion that maybe they're faking it for pain medication. TLDR. We need to assume people are telling the truth more often, not less. I was always taught that it doesn't matter whether or not someone is lying, and not to focus on that, only focus on the task at hand. I think what you stated should stand. Do not focus on whether or not they are lying, focus on treatment. In the hospital setting, a person's responses to admission questions and assessments start to contradict themselves. Then their blood work, urinalysis, scans, or other tests often clarify things. I never assume someone is lying. There are lots of reasons why the same symptoms may be happening. When I can smell the smoke on their clothes and they tell me they quit a year ago, or that they don't smoke weed but I'm getting a contact high just standing in the room. Call it a hunch, but I'm pretty sure none of these kids on meth are actually in contact with Elon and Trump through a chip in their head. Maybe though. Edit, is it lying if they're delusional? Like they're telling their truth, it's just not factually accurate. Does that disqualify it? What about people with factitious disorder? Worked at a pharmacy, a patient we had took too much ibuprofen and paracetamol every time, and we always had to remind her that it was very dangerous for the liver. She told us that all blood tests were okay. She had yellow eyes and skin. ER nurse here. It's usually painfully obvious because what they say doesn't make sense. But unless you have proof they are outright lying, you treat what they say as truth until you can rule it out. Ignoring what people say to you because you know better is always going to end up with you up. Doing the work on a bullshit complaint is always less work than fixing it up. You can't tell whether someone is lying based on their demeanor. If you think you can, you're wrong. Doctors and nurses who know what they're doing guess whether someone is lying in the same way everyone else does by thinking about what the person is saying. Does it make sense? Is it internally consistent? Does it fit easily with the rest of reality as you know it? As a patient who's had so many DRs almost land me in a grave because they assumed I was lying, I think it's nonsense to assume someone's lying. But maybe I'm bitter since I ended up with sepsis in the hospital because you're too young to have X disease. Or maybe it's due to the orthodoctor who wouldn't just tell me, oh, I don't do surgery, but instead told me I was a liar. My injury isn't that bad. You're alive, you lived, get over it, yet I can barely walk, let alone get to another DAR, while my leg is actively falling apart. But yeah, I'm a big drug-seeking liar, former critical care professional here. To answer the question, the most obvious sign a patient was lying was the camera monitors we had in every ICU room that showed us exactly what they were doing, like eating something brought from outside to them and then denying it. I never accused anyone of lying. I just pointed out the camera pointed right at their bed. Yes, we turned them off for baths to preserve what little privacy they got in the ICU. I hate to say it, but as a patient, I get the side eye from my food allergies. I have a stupid, unusual food allergy, and every single time I get a new doctor, I get questioned up one side and down the other. Yes, I'm sure I'm allergic. No, there's unfortunately no diagnostic test for it. Besides, hey, eat this in the hospital where we can watch you have an allergic reaction and then have you be miserable for the next 3 days, dealing the result. No, I'm not lying. If I was lying, it would be something way cooler. Paramedic responding to a man unresponsive on the street. Pinpoint pupils with a syringe hanging out of his arm. Narcan administration wakes him up like magic. I don't do drugs. Good answer. I only smoke weed once in a while. Or I don't smoke while smelling like they just took a hit off of last week's bong water, have symptoms of CHS, or are wearing marijuana-related apparel but forgot they are wearing it. I'll be lying to a medical professional today when I try for the 3rd time to get my COVID vaccine. I'm pregnant and healthy with no underlying conditions. I just want to avoid a severe COVID infection while growing our baby. But it has been an uphill battle to get that approved with the new policies in place. Fingers crossed I can get the preventive care that's right for me with a lie I would otherwise not tell. In the pediatric side, I've seen a parent claim that their child with a genuine serious condition had an allergic reaction to basically every med for that condition. Most of the IVs and wires were tracked the heart with, all plastics despite the child wearing multiple plastic and polyester things. A few other things I'm forgetting. Multiple times in the emergency room straight to the ICU. Try all these new meds, discharge, return in a few weeks with a new allergy, as the reactions never happened in the hospital. But there would be no reach out about allergy. Parent just stopped the med and a few weeks later things would worsen. I suspected that the underlying reason this parent claimed these allergic reactions was a belief in some natural herbs over medicine. Unfortunately, the herbs and oils were not very effective. The allergy list ballooned. The disease got so much worse and the child could not live a normal life, just constant suffering. If their A-stalt liver enzyme ratio is 21, they have cirrhosis with a negative chronic liver workup, yet deny alcohol use. We now use a blood test called a PEth score. Think of it like the A1C of alcohol use. If that is positive, but you continue to deny alcohol use, then we have receipts that you are lying. Not either, but working in residential psych, had a patient who was clearly high come back before curfew, practically nodding off as she came in the door. Sent my co-worker to call the ambulance. She was going to have to be assessed and drug tested before coming back inside, and the patient told me, no, I was just meditating really hard. We'll never ever forget that one. Yeah, her tests came back positive for both alcohol and opioids. EM doc here. You're clearly going through signs of withdrawal from opioids or alcohol, and you swear you don't do any drugs. Once you see those signs enough times, it's hard to miss or confuse it for something else. Same thing with cannabis hyperemesis syndrome. The kind of loud retching it causes is one of a kind and can be heard from halfway across the ED. According to my wife, who's a doctor, they're often lying to themselves as much as they are to the healthcare professionals. No alcoholic drinks more than 1 to 2 drinks a day, and usually they seem to believe it themselves. What she has found to be a useful question is, how long does it take you to get through a handle of liquor? No alcoholic has any idea how to effectively lie through that one, so usually they end up being honest and answering 1-2 days. I work in healthcare, and while I'm always giving patients the benefit of the doubt, but it's all about context. You get used to seeing patients from all kinds of backgrounds, and you get used to what is normal under typical circumstances. At the end of the day, it's about healing or resolving people's main concern, chief complaint. You will get suspicious around med seekers, however. So I'm a pharmacist, but I work in the hospital. I don't care if you're taking your meds well, kinda, but if you say you are, but I can clearly see the last time you filled anything was 2 years ago, means I know more than you're letting on. Just let me know. Otherwise, the team assumes you're taking it, and I have to tell them we won't have good results if we do that.